presentation is about real case for cost effectiveness study conducted in Jordan. I think Dr. Jabir and Dr. Hiba aware or familiar with this such committee. And actually this research was led by Professor Ibrahim Al-Abbadi, and I was honored to work with him for as a second author in this article. This study was about, there were 22 newly registered oncology drugs in Jordan FDA, and the objective is to select the most cost-effective oncology product or oncology drug based on cost-effectiveness analysis in order to be listed in the National Drug Formulary in order to be procured by Ministry of Health. And this is the reference for the reference letter for the official letter issued by the Minister of Health at that time in 2016. This study was conducted between 2016 and 2017 for 1 year. And what we did as a research team, we reviewed and described all meeting minutes produced by the decision committee. And the crucial point faced by such committee was how to identify the clinical benefit or clinical outcome and how to calculate ICER. This is actually due to limited experience in applying health economics. But at least they show interest how to apply evidence-based health policy decision in Jordan at that time. So as I said, there were 22 newly registered oncology drugs in Jordan FDA, and the first inclusion criteria for the drug to be included in the study was based on NICE recommendation. If NICE recommended the drug as a cost-effective, so this drug will be subjected for study conducted by the research committee. For example, abiraterone in prostate cancer, this is approved by NICE after chemotherapy in 2012 and before chemotherapy since 2016. So this drug was subjected to be studied by this committee. Positive sign, this is for positive approval, and the negative for this is not recommended by NICE. The first point I would like to highlight here, what's cost effective in UK or in other country, it might be not cost effective in our country. As we said yesterday, because the cost of hospitalization, the salary of physician, the cost of other procedure is different between UK and Jordan and in other country. And even the cost in our country is much, much lower. And the other thing is it might be the comparator used by NICE or by company, for example, abiraterone is not a relevant comparator in our country. So this is, the committee didn't check whether this comparator was relevant as a policy relevant comparator in our country or not. However, for some drug and based on expert opinion, mainly physician, some drug was included in the study even if does not recommended by NICE for some reason. For example, in banitumab, it is not recommended by NICE as a cost effectiveness treatment, but there was no alternative treatment in Jordan. So this decision is based on an expert opinion in such committee. As I said, the crucial point was how to identify the clinical endpoint in this. So each physician in each disease group were asked to do simple narrative review to extract what is the outcome for each drug. And based on that, for example, cetuximab as a new treatment recommended by NICE, the physician, according to their research, they identify overall survival. For example, it was 23.5 months, and the progression-free survival and the response rate. These are not comparable, and how to solve or how to conclude with one composite endpoint, they decide based on a consensus recommendation to give relative weight for each outcome. For example, in overall survival, and this will be given 50% weight, and for progression-free survival will be 25 and 25 for response. And to conclude the composite endpoint, what they multiply the overall survival with the relative weight and come with a new with one point. This is 28.55, for example, month. And for the outcome, it was the efficacy result, what we get here, minus the side effect. And for cetuximab, there was no side effect. Think about oncology product or oncology drug without side effect.
1 minute, doctor, please.
1 minute? Okay. I have to be more efficient. So I will go to some ICER recommendation. The committee claimed that this study will be conducted from Ministry of Health perspective. Unfortunately, they consider only a drug cost for this study to calculate ICER. And because there was no accepted agreed threshold in Jordan, they decided in each disease area to select the most effective or the most cost-effective treatment. The lower the ICER drug, the better the drug. For example, metastatic colorectal cancer, they choose cetuximab as the ICER was 881 Jordan dinar compared to banitumab. At the end, the summary of recommended drug was concluded by the committee. This is the list. And thank you.